All right. Welcome everybody to our special edition of Tim at 10. I really appreciate those of you that are joining me live this morning for this very special webinar to go over the 89th legislative session here in Texas. Lots and lots of people joining us today, and so super glad that you are here. All right, let's go ahead and get this party started. I do want to go ahead and give you just a heads up, and I know that we got a lot of people that are still joining us right now. There's actually not a lot of information to share with you today. That can be perceived as good or bad depending on your point of view. There's a lot of information that I'm going to be sharing with you today that we just don't have additional information on yet. All right. So there's going to be a lot of to be determined with the information that I'm going to give you today. All right. But it's definitely good information for you to have. Man, look at all these fantastic people that are joining us this morning. Lots of good mornings. So many familiar names and faces that I haven't seen in a while. Super awesome. Great seeing you all. All right, before we get started, we'll go ahead and give our housekeeping items right here. I do have this training approved by the Texas Early Childhood Professional Development System. It does have a trainer ID. So before you complete your assessment for your certificate of completion at the end of this webinar, make sure that your personal TechPeds Workforce ID number is on your Tim the Trainer profile before you complete your assessment. That way your training certificate will automatically be uploaded into your personal TechPeds account. That is very, very helpful for both you, childcare licensing, Texas Rising Star, all of those regulatory agencies that we have to satisfy. Just makes life super, super easier. But again, I just want to stress that your personal TechPeds Workforce ID number needs to be on your Tim the Trainer profile before you complete your assessment, not afterwards. I say automatically upload it into your TechPeds account. It usually takes about 24 hours, but it'll get up in there. If you have any specific questions that are specific to you or your agency, about today's material, there are several different ways that you can get a hold of me. On our website, timthetrainer.com, in the upper right hand corner, you can send a direct message. You can also email, you can also call with any questions that you have, or if you need more information beyond the scope of the training material, or if you need additional resources about the training that we're doing today, reach out to us. We are here for you. Also, just want to throw this out here. Per childcare minimum standards, trainings must be completed in a reasonable amount of time, meaning the total clock hours of training that a person completes in a single day should not exceed the total number of hours that they worked in that day. Definitely, you cannot complete more clock hours of training than there are in a waking hour of a day. I just want to make sure everybody is in compliance and that you don't have any issues with licensing or Texas Rising Star not wanting to accept your training certificates because you completed more clock hours of training than there are hours in a day. Okay, should be common sense, but seems to be a big problem around the state. Also, just, you can refer to the definition of instructor-led training in the Childcare Minimum Standard, Standard 746, 123.39. There is an opportunity for you to ask questions and to interact with the instructor in a timely manner, as I mentioned above. But it is up to you to get with your local licensing inspector and your Texas Rising Star mentor for their interpretation of instructor-led training. All right, so as we begin this conversation on the 89th legislative session, when I was getting ready for this, I came across this quote that I thought would be really good to share with you as our opportunity to unite, right? And this is a quote from Dr. Becky Bailey from her book, Managing Emotional Mayhem, on page 35. If we offer condemnation to others, we will not feel good enough about ourselves. When we offer well wishes to others, we feel peaceful inside. And I wanted to share that with you today because as we go through this legislative recap, there are a lot of people that have some very strong feelings and very strong opinions about what's going on politically in our country, in our state, and definitely how it impacts, licensed childcare facilities. So, with that being said, I would like to make a commitment for all of us that are participating in this webinar today to make a commitment to the power of unity. And when we practice the power of unity, we're all in this together. All right? Doesn't matter what side you're on, what political views you have, what your opinions, your beliefs, your convictions. We got to look at, the common good, and we are all in this together. So the commitment that I've got up on the screen, this webinar today is to inform, to train, and to coach. All right. So today's webinar is not an opportunity or platform to express political views, opinions, or comments. Our mission at timthetrainer.com is to support all early educators without judgment, no matter what political side you are on. So, with that being said, we are going to ask anyone who expresses a political opinion or makes any comment perceived as derogatory towards any political side, we're going to ask you to stop. If it continues, we may ask you to leave the webinar. We want everyone to feel comfortable and safe to learn and be informed without any judgment or awkwardness. All right? So that's the power of unity. We're all in this together. Okay? So if we can all make that commitment as we go through this material, that would be awesome. We want everyone to feel safe. Okay? And respect each other's, opinions and views. But for today, this is about informing, training, and coaching. So all of that is in another platform. All right, so here we go. All right, and again, those of you that are just joining us right here, there's not a whole lot of information to share with you today. Nothing that, is going to rock your world today. There is a lot of to be determined that we're going to talk about today. So we're going to need to do some follow-up and some, recap of some of this stuff right here. So some of these are pretty straightforward. Some of them, a lot of them are not. So the first thing we have, Senate Bill 1619. Basically, the only thing this one does, it is going to modify the term epinephrine auto-injector to an epinephrine delivery system, which includes the epinephrine auto-injectors or epinephrine nasal sprays. So just a little bit of some change in terminology is what this one is all about. So the action that is required by you in your program, just simply update your current policy that you already have on epinephrine auto-injectors so that the language will be consistent with the way this is going to be worded now, and to include the nasal spray in your language. All right. So in our 88th legislative session, we had some legislation about epinephrine auto-injectors. This is just basically updating language. Pretty easy right here. Then we kind of move into House Bill 163. And again, Not a whole lot going on right here. This is going to remove childcare facilities from the list of places that might be required to have such a policy related to storing, using, and throwing away epinephrine delivery systems if they are already required to do so by another law. All right, and that's the key point right there. If they're already required to do so by another law. So the use of epinephrine delivery systems that is listed under the Americans with Disability Act as a reasonable accommodation to a disability or a special care need. So even though they're going to be removing the language about handling, storing, and using the devices, it's still in ADA language, all right? So when we look at ADA law, private businesses such as licensed child care facilities and after-school programs who are required to follow ADA law will not make any changes to your current policies. You're just going to continue to do what you've always done. Programs that may be exempt from the Americans with Disability Act is no longer required to have a policy on how to maintain, use, or dispose of the epinephrine delivery device. However, the operation may choose to develop and implement a policy to ensure the health and safety of an individual in case of a severe allergic reaction, and that's what I recommend. All right. I got a question in the comment. Have I ever heard of a child with the nasal spray? I've never had this situation, so I personally have not had this experience, but apparently some of these are out there, all right? So some of you might have the opportunity to experience that. All right, so House Bill 2789. This is probably the biggest one that you're going to see from a standard and regulation standpoint. And there's a couple of different pieces to House Bill 2789. So basically, child care regulations will no longer require TB testing or TB screening for anyone. However, keep in mind that your local health department, your city or county health department may still require TB screening. So just because they're removing it from the minimum standards, it may still be required in your local area. Honestly, this probably isn't going to change anything that you're already doing. Licensing has not been regulating TB screening for a while now. It's just going to be removing it from the statute. They're also reducing the amount of liability insurance from $300,000 to $100,000. This one scares me so bad. I would not recommend reducing your liability insurance. I understand that it's expensive right now. I understand that it's very hard to find an underwriter that will write a policy for your particular program. I understand that they're looking at compliance history, they're looking at risk, they're looking at all of this stuff, and it's expensive. Get it, understand it, been there, done that. However, the flip side of this is we also are dealing with more lawsuits and more insurance claims than we ever had in this industry in history. We have attorneys that have billboards on the side of the highway that say, "We sue child care centers," all right? I just got a notification this morning about a lawsuit that has been filed against a licensed child care facility for a child that was injured on the playground. So, you know, the fact that they are coming in with 2789 and reducing the amount of liability insurance, y'all, this scares me right here. Now, also keep in mind that they're only referring to liability insurance being reduced to $100,000. We're not talking about student accident policies, employment practice liability insurance, umbrella policies, cyber liability. I mean, there's so many other policies. your liability insurance for your buses and vans. All of this stuff is in addition to your liability insurance. So kind of keep that in mind whenever you look at this, that while it's reducing liability insurance, you have all of these other coverages that you need to make sure that you are adequately covered. $100,000 is barely going to cover you legal costs if you had a significant event. And if you did have a payout and you only have $100,000, you're going to have to pay that out of your pocket, and most of us cannot afford that. So I would have serious conversations with your insurance agent, with your underwriter, before you make any type of change right here. All right. Also changing, $27.89 for a brand new program. Their initial license is now going to be valid for 12 months opposed to 6 months. And then Health and Human Services requirements for maintaining vision and hearing records is being appealed. All right. Now, even though Health and Human Services is repealing vision and hearing screening, it is still required by the State Department of Health Services. All right. So we are still required to maintain vision and hearing screening, and we are still required to report vision and hearing screening by June 30th of each year, just like we've always done it. All right. So there have been 2 state agencies, HHSC and DSHS, that has required vision and hearing record keeping. One of those is going away, the other one is not. So once again, no change right here. All right. And with the general liability insurance, they're going to continue to regulate according to statute until the new rules are updated. And kind of the same thing with the permits right there. Okay. So, Connie, I see your question over there, and from what my understanding, yes. All right. Kind of moving on. We've got House Bill 117. House Bill 117 is going to establish a task force administratively attached to the Texas Education Agency that must address the governance and operational challenges of early childhood education systems in the state. So at this point in time, there is no action required by any of us. However, those of us that advocate for licensed childcare and early education, we will keep a very close eye on this task force and try to be involved as much as possible. We just don't know exactly what the intention is yet or what their goals are, but we will keep a very close eye on this task force. There are a couple of different times that you're going to see a mention of Texas Education Agency collaborating with licensed childcare, which is something that's not typically been done in the past. And once again, we just don't know the full intention of this. A lot of other states that I work with, the Department of Education is involved in licensed childcare. That has not been the case in Texas in the past. So we just don't have enough information yet. This could either be really, really good for us, or it might have some challenges. We just don't have enough information at this point in time. Let's just wait and see and send a lot of well wishes. All right, House Bill 2310, once again, is going to require Texas Education Agency in collaboration with Health and Human Services Commission and Texas Workforce Commission to develop and implement a strategic plan to improve early learning and educational opportunities for young children with disabilities and developmental delays. All right. So this one looks very promising. It looks like we're going to be getting some additional support and help with children with special care needs. disabilities or developmental delays. Again, this one, there is no current action required by any of you. It's just an FYI. Once again, we will keep a very close eye on this collaboration and really watch what the intent and how this is going to be implemented. All right? So, yes. Ernestina, I see your question, and from my understanding, yes, it does. Everything that I've got in this webinar is going to apply to all. House Bill 4903. This one is a very interesting one right here. This one perked my interest. I'm very interested in this one. I've heard a lot of conversation about this even prior to it passing. But this is going to establish a Quad Agency Child Care Initiative Commission. The Quad Agency Child Care Initiative is intended to foster collaboration, coordinate policies, and review and streamline regulations between the 4 agencies participating in the initiative. And those 4 agencies are Texas Workforce Commission, Health and Human Services Commission, Department of Family and Protective Services, and the Texas Education Agency. So once again, there is no action required at this time, but we're going to keep a close eye on this. From my interpretation of what I have seen with this Quad Agency Initiative, this could be exactly what we need. We've been dealing with a lot of inconsistencies between agencies, especially in the last 18 months. A lot of you probably know what I'm talking about, where you've got childcare regulations that has one interpretation of a definition. You've got Texas Rising Star that may have a different interpretation of a definition. And then now we've got like CLI Engage that is doing the assessments for Texas Rising Star programs that has a whole completely different definition of an expectation. And these 3 agencies are not consistent. And we've got a lot of programs that are struggling with this and kind of paying the price. And it really kind of started when CLI started doing the assessments for Texas Rising Star. So when you look at House Bill 4903 with this Quad Agency Initiative Commission, this might help solve a lot of these inconsistencies between different agencies. All right. So again, we're going to keep a very close eye on this one. I do think that this has got the possibility of being very helpful to us. All right. We got to get everybody on the same page. All right. I got someone asking about 4903 on the time frame for implementation. I don't have that information at this time. All right. Again, there's a lot of this stuff that is a to be determined situation for us right here. I'm hoping to get on some of these commissions and task force is what I'm campaigning for. I would love to express my voice in some of these situations. So, you know, that's what I'm working on. All right, everyone take a deep breath. Okay, you are safe. You can handle this. All right, we can be patient and learn more information before we pass judgment or before we create an opinion. Y'all, sometimes things may not appear to be in our favor. A lot of times we just need more information, you know, before we get all fired up, okay? So, with that being said, Mike says, how can we support you being selected? Talk a lot. All right, just keep on talking, throwing those names out there. So with House Bill 2, many of you are familiar with House Bill 2. It got a lot of media attention. We had a lot of special sessions on this one. But this is basically the education savings account. All right, so it's going to focus on different parts of the state's education system, including giving funds to schools that accept children in state care. So once again, you've heard about this education savings account. Let's make sure we're using the right terminology when you're expressing, comments about, this particular area. It is not school vouchers. That is a slang word. All right. It is the education savings account. So what we're looking at right now with licensed childcare, because when House Bill 2 first came about, there was mention that licensed childcare would be included in the conversation. And if you had a pre-K program and you were part of Texas Rising Star, or you were accredited by NACCE or the National Accreditation Commission or a few other accrediting bodies, then you would be able to take part in the education savings account. All right. So earlier this month, the Texas Comptroller issued the rules on this. So where a normal education institution is going to be allocated $10,300 per year per child, the language right now is that licensed childcare facilities that meet the criteria for pre-K, the family's only going to be allocated $2,000 per year. All right. Now, again, there's been a lot of attention. We have a lot of advocates that have expressed their point of view on this. We have Child Care Services, we have Texas Rising Star, we have Child Care Aware. I mean, the list goes on and on for the different agencies that have expressed their concerns about how the comptroller is handling this. We did have a period where we could give feedback on House Bill 2 and the comptroller's ruling. That deadline did end on September 21st. I don't think this is over with yet. All right. I do believe that this is going to continue to be discussed. I don't think we're going to see resolution for a while. All right. And so, kind of keep your eyes open. And when there is an opportunity to provide more feedback, when you do have the opportunity to have this conversation with your local lawmakers, I would take that opportunity. Okay. From a child care licensing point of view, there is no action required. This really has nothing to do with child care regulations. But once again, we're going to keep a very close eye on the implementation of these funds and how they're distributed and how licensed child care will benefit from the bill. Once again, I don't think this is over with yet. And we're looking at the 26-27 school year for implementation. So, House Bill 571. So yes, the comment over there. So a child attending a child care center in a pre-K classroom, if the center meets the criteria, yes, $2,000 versus the $10,300 that they would get in another school. So yeah, we're being shortchanged quite a bit. So again, this isn't over with. All right, so House Bill 571, this one you do need to pay attention because this is going to require action on your part. So this is going to make an amendment to the family code by requiring a professional, which includes child care employees, to make a report no later than the 24th hour after the professional has a reason to believe that a child has been abused or neglected or a victim of an offense. All right. So basically we're talking about child abuse and neglect reporting. All right. We've always been mandated reporters. All of you should already have this in your policy manual. But the change right here is that if you have someone that suspects abuse and neglect, they have to make the report within 24 hours. Okay, so you're going to need to update your policy manuals accordingly, update any training or professional development that you use for child abuse and neglect reporting. Make sure that that is in there. Okay, so again, has to make that report within 24 hours of the suspicion. So that is a pretty big one right there. Last one that I wanted to share with you, and then I've just got some numbers for you. We talk about Senate Bill 462. Many of you have inquired about this one right here. This is going to require Texas Workforce Commission to establish a priority child care scholarship waiting list for children of certain child care workers who are eligible for child care services. So basically, any of your employees that work for you that have children in care, if they are eligible, they will be placed at the top of the waiting list as a priority. But we are not the priority. All right, so that's one thing I want y'all to understand right here. We are not the priority. We are one of the priorities. Foster children, low income and at-risk children, the at-risk children really, are number 1 and number 2. Okay, from what I'm understanding, when you look at the priority list, you know, we're like number 3 on the priority list. So there are going to be some children that have a higher priority than child care workers' children, but at least we've been moved up to the top of the list right there. Okay, this is definitely one of those to be determined conversations right here. No further action is required by you at this time. Texas Workforce Commission is anticipating the changes will be in place by December of 2025. Texas Workforce Commission is also developing guidance for child care workers who are already on the waiting list. Okay, so this is an exciting one. This is a really good piece of legislation, in my opinion. You know, I've been getting a lot of phone calls and emails about trying to be one step ahead. You know, if you've got employees that have children in care, I would probably tell them to go ahead and start applying and get that process rolling right there. And then once we receive further guidance from Texas Workforce Commission by the end of the year, we'll have a little bit more information to share. Now, let's hit the pause button for just a second, because I also want to remind you that we have other legislation that requires licensed child care centers who participate in child care services, who care for children that are subsidized, you are required to participate in Texas Rising Star. So if you're a program that currently does not accept subsidized children, and you currently are not participating in Texas Rising Star, if you do get a CCS contract so that you can be subsidized for your employees' children, that's also going to kick you into Texas Rising Star. All right? So I just want to make you aware of that. Okay? I think that's a wonderful thing, because I'm a huge advocate for Texas Rising Star. Anything we can do to increase quality in our programs, I'm all for it. Okay? But I just kind of want to make you aware of that. There are also some other rules that we're going to have to wait and see if they are amended or how they're going to be perceived. For example, the director having their children enrolled in the program, typically that is not allowed in a subsidy situation, you know, due to the potential of fraud. We're going to have to wait and see what they do with some of those rules too. And Tracy, you're absolutely right over here. Homeless children, military children, those are also priorities. So, you know, there are other children up there that are up on that priority list other than us. All right? So kind of keep that in mind. Last thing I wanted to share with y'all, and this is more of a FYI, just because I'm a numbers person. I'm a big statistic nerd. I like my data. I like my spreadsheets. So when we talk about the state budget, the Texas legislators did approve an additional $100 million to support child care services for the upcoming 2 years. So you'll see that they're allocating an additional $50 million for 2026 and $50 million for 2027 for a total of $100 million over the 2-year period. That is a very nice increase to help support our programs. So you can kind of see the total allocation of money that is being pointed towards child care services. That's a very impressive number. Okay, this additional money that is being added, it is estimated that this will support an average of about 148,000 children per day. So that's nice right there. Texas Workforce Commission's base payment rates are set at the 75th percentile of the most recent market surveys. There was an increase of 9% in the 75th percentile statewide, based on the 2025 market surveys. So overall, Texas Workforce Commission is projected the cost of care to be increased by 12.7%. So that is some encouraging news right there too, that they are aware that the cost of operating our programs is going up significantly. Therefore, how much we are reimbursed for our children also needs to be increased. So really good information. The extra money that's being added is going to be able to help supplement that. So this is some good news for us as well. All right, so basically that's it. Like I said, there's a lot of to be determined. I am very optimistic about where we are going. We still have some work to do. We've definitely got to work with the comptroller on that House Bill 2. We've got some interesting initiatives with the different task force and the quad agency collaboration. We're definitely continuing this transitional period that we are in with the childcare industry. I know many of you are also familiar that there is some very interesting initiatives that are being put in place in other states that really don't pertain to Texas. However, we always want to pay attention to what's going on in other states because this creates trends. All right. I've gotten a lot of questions about what's happening in New Mexico with universal childcare. And my response to everyone that reaches out to me on that one, we just don't have enough information yet to see how this is going to impact private licensed childcare. All right, whether it's going to be beneficial or whether it's going to be hurtful. We just don't have that information yet. I will tell you that I do have some clients that I coach and train in that state that are actually very excited about that initiative. So they apparently have some information that we don't have yet, or with them being boots on the ground in that state, they have a particular opinion that we may not have the information to form yet. All right. So again, y'all, so much of this, we just have to be willing to hit the pause button and get more information before, we make comment or form an opinion or judgment. Let's all practice that together. Okay. So that is our recap of the 89th legislative session. I appreciate all of you being so cooperative and professional. Very, very impressed. Thank you so much. We will go ahead and post a link in the comment section for those of you that are wanting a certificate of completion for this live training event, those of you that are participating live. you can go ahead and complete that assessment to get that training certificate. If you're watching the recorded session, then you can click on the link on our website once it is posted, and then you can get that certificate there. Those of you that are doing it right now, it's live. Yay, you got this. As always, feel free to reach out to me if you have any questions, if you need more information beyond the scope of the training material, if you're needing additional resources, please reach out to us either through messaging us on our website, email, phone call, in person, whatever works best for you. We are always here for you.